Well, welcome to this breakout panel on women and cardiovascular disease, a really, really important topic. And I know there's a lot of interest in this subject in the wider summit. My name is Jackie Thornton. I'm a freelance health journalist for The Lancet, the BMJ and Nature in the UK. And I'm going to be moderating this session with 4 excellent speakers from around the world. So we know that in order to look after our own heart health, women need to be more aware of how heart disease presents differently in women. And it's something that patient organisations like your own are working really, really hard to share with their communities. So women with heart disease, they have to grapple with physical and mental health consequences of delayed diagnosis, of dismissal of their symptoms and of undertreatment. And I think that changes to policy and practice could really improve the health and well-being of women around the world. We also know that women are underrepresented in clinical trials, so drugs and therapies don't get to them quickly enough, and we don't really know how they fully work in female patients. But researchers have made limited efforts to try and correct this. So these are all issues that we'll be coming to our panel with. I just want to say that this is a panel and a session for you, and so there's lots and lots of time for you to ask questions of this panel of speakers. We've got 30 minutes of Q&A after an initial time to hear from each of our speakers. So please do send through your questions on the Q&A section of the platform, not the chat form, and we'll get through as many of them as we can as possible. Some housekeeping. We do want to obviously get the message across to the wider world, so please do get in the conversation with social media using the hashtag GHHUnite, and so more people around the world can hear exactly what the importance is of cardiovascular health in relation to women. So let me introduce our speakers. We have 4 very different perspectives. First of all, we have Jackie Ratz, who's joining us from Winnipeg in Canada. She is a heart failure patient, also a cancer survivor, and she'll tell you about how her diagnosis of heart failure came about. She's a very staunch advocate and a founder of a Facebook group called Canadian Women with Medical Heart Issues, and she'll tell you how that's developed and become affiliated with other organisations. Welcome to you, Jackie. We also have Vilma Gerard, who is the Chief Executive Officer of the Vilma Gerard Voice, and also she's belongs to Harper at Global Action, an enterprise company. She'll be talking more about that. And she too is a patient advocate based in Switzerland. So welcome to you, Vilma. We now have Caroline Bahage, who is the founder, chairman of Stichting Vuhen Hart, which is actually the Women's Heart Foundation. So apologies to any Dutch people for hearing that awful Dutch word. She is also a patient herself, and she's joining us from The Hague. So thank you to you for joining us. And last but not least, we have Selena Gore, who is the Chief Executive Officer of Women Heart, the National Coalition for Women with Heart Disease, and she's joining us from Washington. So we've got a packed afternoon of discussion on this subject. I'm sure we could have the whole of the Unite Summit talking about women and cardiovascular disease, but actually we've got an hour, so let's make it worth it. So let me first of all pass the baton to Jackie Ratz, who's going to be talking to us for 5 minutes. Thanks, Jackie.
Hello, everyone from Winnipeg, Manitoba, where it's morning still, so good morning. I'd like to share a little bit of my story with you. I was diagnosed with chemo-induced cardiomyopathy back in 2014. And this we have to rewind the clock a little bit, because my journey with heart disease actually started 20 years prior to that at age 24, when I had non-Hodgkin's lymphoma. So for the period of 24 to 26, I was dealing with chemo and radiation and dealing with the tumor that was putting pressure on 25% of my heart, as well as on one of my lungs. So through the treatment, it gave me 20 great years. And then in 2014, chemo-induced cardiomyopathy. And when I walked into my cardiologist office, he actually said to me that I was right on time. Those words have stuck with me through and through. It's not easy being diagnosed at age 44 with heart disease, especially when you're not expecting it. I had a heart event just prior to that that caused me to wonder whether the cancer had come back. After being diagnosed with heart disease, heart failure followed very quickly. 3 years later, I found myself the proud owner of a CRT device, so I carry around my own defibrillator now. And more medications were added. I went to cardiac rehab, and honestly, I ended up on disability because I could no longer perform my job as an apparel buyer, which I had been doing for about 20 years. So through that experience of being diagnosed with heart failure, I was looking for some supports. I was looking for some Canadian supports. I had joined a number of Facebook groups online, but most of them were based either in the US or in Europe. And our medical systems are quite different. And I found that the conversation just wasn't fulfilling what I was looking for. So I started the Canadian Women with Medical Heart Issues back in 2017. And now we're up to about 1,000 women. And through that, through starting that group, I found that I was better mentally. I was better even physically. I had more knowledge. And we're a very casual group. We're not medical experts or anything by any stretch, but it really impassioned me to be able to want to advocate more for women. So through starting my own group, I also got associated with Heart Life Foundation. And the Heart Life Foundation is a nonprofit organization here in Canada for, it's the only one actually for heart failure. And it's led and run by patients. And their focus is very much on wanting to make sure that they engage, educate, and empower patients, and then as well as get them involved and in front of clinicians and researchers. So through that involvement, I also was able to get involved with the Canadian Women's Heart Health Alliance. And this is a fairly new organization that came out of a Canadian Women's Summit that was held here in Ottawa through the Ottawa Heart Institute. And they have now had three summits on women's cardiovascular health. And the next one is coming up next year, actually, and it's free virtually. So you may want to check it out online in April. And we're excited about that. And that organization has moved the needle more than I think some other organizations had. I also work with a little bit with the heart and stroke and share my story nationally as well as locally, trying to change the dialogue around women and cardiovascular health. So for me, the biggest thing about women and heart disease is the fact that we are unaware of the fact that, you know, heart disease is the #1 killer of Canadian women. And, you know, I believe that it's also the #1 killer nationally, worldwide. And yet we still seem to be unaware. And in fact, attention to it is going down. Awareness of it is going down from where it was even 5 years ago. So really, we need to try to focus on the awareness piece. We need to try to focus on the support piece because women are still not getting the helps that they need. And, you know, realistically, I mean, I don't know how many times I'm tired of hearing that women are just small men, you know, and we need to get women more involved in research, you know, looking at different treatment options as well for women and getting them diagnosed on time. So, and that comes from the Heart Stroke 2018 report. So we're well into 4 years now. We need to do more. Thank you very much.
Thanks very much indeed, Jackie, for that excellent presentation. And again, can't believe it. It's such an early diagnosis, but you've obviously, you know, done some amazing work since then. So very good to hear. Let's move on to Wilma Girard now. Wilma, I think you've got a different story, so please do let us know what your thoughts are. I think we're having a few problems with Wilma's sound. I think there you go. That's excellent. Go ahead.
It should work. Excuse me. So go back. Wilma Girard. I'm French. I'm living in Switzerland. I'm 15 years old. And just to give you some background about my medical story. So I've been hospitalized 5 years ago due to arterial thrombosis in the left arm. And this is where I was diagnosed with a cardiovascular disease and a type 2 diabetes. We first start with the implementation of an umbrella, a device to repair my heart. But after a couple of months, I had a stroke, and we also realized that there were some issues with the device, and I went to open heart surgery. There were a lot of months for rehabilitation, from a cardio and neurologic aspect, but I'm still in rehabilitation program and I am getting a lot of treatment, but happy to still be alive. When I look to my family story, the story is my mother was also diagnosed for type 2 diabetes and cardiovascular disease. Unfortunately for her, she died around the age of 40. There were no new technology available at this time. There were a lot of time to get an appointment with cardiologist and with surgeon, and she passed away before getting this appointment done. So based on my story and the impact that it had from physical change, mental disorder, and also I lost my job 2 years ago when I was supposed to go back to work. I have to change everything in my life and to take some position about who I am, what I'm doing. And I founded two companies, one Voice for Enterprise, and the second one 6 months ago for patients and their families. We are specialized in alternative therapy, in medical coaching and training program in mental health for first aid, stress management. When I contact Global Up Earth, I join the individual patient advocacy network because I discuss with women and also within my community about the challenge that I have and that they have also, and we identify some issue. First of all, from the early detection program about the disease, about the fact that there were no diagnosed with when some family story are present or when there are some comorbidity in the population at risk. The second was also the access to the medical care with, for my mother, the waiting list to get an appointment, to get some consultation, to get also advice, to get information. Also, there are some lack of training program for the patient itself, for their family, for the caregiver. And also, there were a lack of consideration of the impact that the disease has on your life, from physical aspect, change, scare, pain, fatigue, the fear also that we have, the physical, the psychological aspect about depression, anxiety. No one talk about this, but it's there. And also at the society level, the work, the relationship, the cost of the medical care, but also, and not less, the stigmatization and discrimination that we have. There is also an important thing for women is to reappropriate their place in that society as a woman, as a mother, but also as professional. And for me, was also the inclusion of the woman voice in research and development, in clinical research, in partnership with the medical team, with the industry, in the politics, where for me the patient voice and especially woman voice are important and should not be considered as a checkbox. So that's fine now. Even I'm tired, but my purpose in life is really to become an advocate, to really support a patient, their family, give them access to education, give them access to the knowledge and the voice also to face all the challenges that they have in their own life, but also at work. And of course, I'm a Black woman, so it's important for me that the Black community is represented, and I will be one of the voices to do that. And I hope in the future to have a network, an association of women, of patients that will be working together in order to make our voice heard and make some change.
Thanks very much, Wilma. And just answer me this. You said that your age now, what age were you when you were diagnosed with a thrombosis?
44.
44.
Oh, and
So that's the same age as Jackie, ironically.
Yes, same.
Okay, thank you very much. Well, I mean, again, I'm so sorry to hear of the loss of your mother at such a young age. That's absolutely tragic, and I'm sure that, you know, around the world there are similar stories like this happening, which obviously, as you know, could be prevented with awareness and with knowledge and appropriate treatment. But we'll move on to that in this discussion. I'd like to come to Caroline now. Caroline, I hope you have a happier story for me.
Yeah, well, I don't think so, but I'll tell my story. Thank you for inviting me. My name is Caroline Verhagen, and I'm from the Netherlands, and I'm a heart patient. In 2016, I was not feeling very well. I had a beautiful job, 2 very nice kids, a nice social life, and then all of a sudden I was feeling very tired and not feeling very well. So I went to the doctor and they said, well, maybe you're too busy, you have a lot of things going on in your life, but for the rest, there's nothing wrong with you. Every week with a girlfriend, I went to the gym. This time also we went to the gym, and while I was there, I was not feeling well again. And I said, well, I'm going home because I'm going to go to bed. I'm feeling sleepy and tired. And then my sports instructor came and she said, what's wrong with you? And I said, well, I have this neck pain and I'm tired all the time. And she said, I think you're having a heart attack. And for me, that was the first time I ever heard anybody ever suggesting that it might be something with my heart. So she said I had to go to the hospital to get checked out, and there they found high troponin levels. So I was having a heart attack. At that time, I was 1 week in the CCU on the cardio care unit. I had a lot of examinations, but again, no cause found. They even did a pregnancy test, so everything was checked out. With a lot of medicines due to protocol, I was sent home. But now I was aware that it was my heart making me feel tired. And I did some online research, and there I came in contact with a cardiologist in the Netherlands. And I made an appointment with her, and that was a great relief because she knew what was wrong with me. And apparently, I had a SCAD, which is a spontaneous coronary artery dissection. But unfortunately for me, there was already damage done. I had to have an open heart surgery. So if they'd known before, that would make my life a lot different. Around that time, I just decided to start with a website to publish information about how women's heart disease differs from a man, because I had to find everything myself. Then I started a Facebook group, and to my surprise, there were a lot of women of my age that also had heart problems. Before that, I thought I was the only one. The group kept growing and growing, and I got in touch with women that wanted to help me spread the word about how women's heart disease differs from that of a man. And together we founded Stichting Vrouwenhart, the difficult word, Stichting Vrouwenhart. And what do? We have a website, and we provide available and reliable information about the differences. So we publish that. And also we have created several Facebook groups where fellow patients can meet and communicate, sharing their experiences, fears and hopes. And then, the last question is, why do I do this? Well, because what I have experienced in life, I wish upon no one. So change must come here. And I think this meeting with all these people here is another step in the right direction. So thank you.
Thanks very much, Carolina. Again, very, very compelling personal story, and we thank you for telling it. Selena, I'd like to come to you now. Now, you, I understand, are not a patient, but obviously you have a senior position in the organisation. You want to tell me about it. So please do, you have the floor.
Thanks so much, Jackie, and thanks for the invitation to this important session. While I don't have heart disease, or I should more accurately say I've not been diagnosed with heart disease, I have had the experience of going to the ER 6 different times with what feels like a heart attack, and each time not having found anything. Each of those sort of episodes sort of has added up to something that my doctor has been calling persistent hypertension. And so I would say my story continues. You know, this is a comeback next year, and maybe, you know, I will be able to update this story. But as the head of Women Heart, and you know, I should say these episodes happened long after I became the CEO. So maybe there was some serendipity there, because I fell right into a community of support. Women Heart exists to do similar things to the organization that Jackie mentioned in Canada. We provide support, education, and advocacy. And we are here for women, and in turn, we enable women and empower women to be there for each other. Because as we've heard from the previous 3 speakers, being there for one another is fundamental to our understanding of what's happening with us. It's also incredibly important for our mental health. So that is sort of the core of what Women Heart is when it started back in 1999. So we provide support groups that really serve as a mental health safety net. We provide information and education from the hospital bedside to the community health fair to online webinars. So we sort of run the gamut of support, and the pandemic has been actually quite instrumental in accelerating our presence in the online space. And then we provide advocacy. You know, we bring Women Heart champions, is what we call our volunteers, to Washington, D.C., to make sure that lawmakers understand that there are unique needs for women with heart disease. So they advocate for better access to quality care. And we also advocate for policies that really spotlight health equity. Here in the US anyway, we know that heart disease disproportionately impacts certain communities of color more than others. And so we want to make sure we are shedding light on those disparities, in addition to the gender disparities that we've all talked about already. So why do we exist? Again, it's because we need to be aware. Jackie said, you know, awareness rates are quite low, and it's distressing to know that they're decreasing. As she said, only 50% of women recently surveyed in the US know that heart disease is their #1 killer. And I think that, you know, to be honest, there's a battle for airtime. You know, I think a lot more people are aware that breast cancer is a threat to women's health. However, I think they don't realize that heart disease is a far bigger threat. So, you know, I think there is some market share question there about what sort of diseases get airtime. We need to be represented. Only 14% of cardiologists are women. And that is dreadful, especially when we know that patients of female cardiologists have better outcomes, regardless of whether they're men and women or women. And we need to be believed. I think this is fundamental. You know, we shouldn't have to be fighting to be believed, and yet we do. You know, you can hear it in the stories. You know, I have my own experience of not being believed when you show up to, you know, the emergency department and being told, oh, it's just anxiety, or as Carolina mentioned, you just had too much on your plate. You know, it's nothing. We need to be believed. So I'm so happy that this discussion has been elevated to a session during the summit, and I'm looking forward to the conversation.
Thanks very much indeed, Selena. So 4 very, very compelling talks there and presentations. It's extraordinary, you know, what you've drawn together is this aspect of the fact that, as Selena has said, not believed, even though in Vilma's case there was family history, and in Jackie's case there was a reason for why there was a strong likelihood of getting this heart failure. But these things just aren't being picked up. So basically it's underdiagnosed and therefore undertreated. I'll come to Jackie first of all. Jackie, why do you think this is happening, particularly when, as you know, in your case, he said it's about the right time. He always knew it was a possibility, but had nobody ever mentioned the possibility to you? And you know, why do you think that is?
Well, I can speak to, in my case, we have to think back to the fact that this was now over 30 years ago. And at the time, they were less aware of the implications of what chemotherapy will do on organs, especially the heart, kidneys, liver. And they really had no proactive measures to be able to protect any of those organs. So, you know, research has now been done to be able to indicate that, yes, you know, we're living longer after these treatments and everything, which is wonderful. And the treatments need to be aggressive in certain cases. I only had a 40% chance of surviving. So my chemo treatments were very heavy-handed, as was my radiation. And so they never mentioned it. They followed me for 10 years and I never showed symptoms. So at that point, I finally got you're in remission, you're cured, you're fine. And it was 10 years after that I got the diagnosis. So when I walked into my cardiologist office and I explained my history and such, and he said, "You're right on time," it was based on more recent research that was done, which was great. The problem with that research, though, however, as has been mentioned, is most of it's been done on men. And, you know, and that in and of itself is a bit of a problem because, you know, women come with a different set of criteria. We have our hormones and we have pregnancy and we have, you know, so there is different reasons for making sure that research gets done on women as well as on men. As you know, that's not to take away from the research being done there. So for me, it really was about making sure that for me at the time, it was really about then understanding why wasn't I told and how come. And I understand that research is ongoing and thankfully we are making inroads. But man, we got a lot of work to do yet to get that research caught up for women specific.
Let me come to Carolina. Carolina, you said that you'd obviously been to your doctor and they'd said they haven't, just said you're busy. No, why do you think it's why are they saying things like that? Why are they not looking further? Why is it underdiagnosed and undertreated?
Well, I don't think it's unwillingness, but I think that they don't have the information, so they don't know. And they look at you and they see a young, healthy woman, because on the outside you don't see it. Well, they don't think about it. So that's the main problem, because when I was in the hospital, they tried everything they saw that I was having a heart attack. They tried everything to help me, but they didn't have the information about the differences between a heart attack with women and with men. So they didn't know how to help me. I think that's the main reason. We find that there are still a lot of women that get undertreated because their doctor or cardiologist doesn't know about the differences. And I think that is somewhere to start to educate everybody, the patients and the doctors, because
exactly. I mean, undertreatment is one thing, but when you had these warning signs, which had they been picked up earlier, might have prevented you from having open heart surgery. The doctor dismissed your concerns. It's hard to know how to advocate in that position, isn't it?
It is very difficult because my life would have been completely different. Now I'm a heart patient. If they'd known before, then they could have treated me. And then, well, I always say you asked for a positive note. It's strange that this happened to me, and it's awful, really, but I'm very grateful for the work that I can do now, because we can help other women that were not aware they are having this. We can help them with giving them information and make sure that they say to their doctors, this is what's happening to me, and I think it is my heart. So we try to create this awareness in the Netherlands.
Sure, thank you. Let me come to Vilma. Vilma, again, your mother sadly passed away due to heart disease. That's a family history. You would have thought that their doctors may have been more alert to your situation, but the thrombosis was picked up by chance, was it? Or was it linked to them knowing about any family history?
So the family story came after the thrombosis, where they start to look at the genetic, especially in Black women. We do know in the Black population that we may have some issue with our coagulation. So this is was really the first thing that we were looking, because there were a lot of thrombos, and they didn't know, and they didn't even suspect there was something wrong with my heart. So that's really by chance that they discover the, and when we discussed, I talk about the story, my mother, what's happened to her. And I asked, maybe it would be nice in my family that we also make a detection. So I called my sister and my nurse and asked the doctor to do also the diagnostic and test. And it's the case. They have the same issue. That's why for me it's also important, you are a patient. The heart disease is a silent disease. We have no symptom. Everybody told us, you did not see anything? No, before it becomes really critical, you don't have any pain, nothing really special. I mean, you are tired, but what does it mean being tired? So we don't really look at the symptom. We don't know what are the signs.
It's almost as though doctors expect women to be tired due to the multiple demands that they have with working potentially in children, etc., and caring for older people. And it's almost, it's a difficult line, isn't it? Let me come to Selena. Selena, is there an element of, I wouldn't maybe put as much as sexism, but just a stereotype of how women are, which is leading to these lack of diagnoses?
I think you've hit the nail on the head. There is, and not only are women expected to be tired, women expect themselves to be tired. So we think, oh yeah, I have a full plate, and that's why I'm feeling this way. What we talk about in the context of Women Heart and the support groups is it's so critical to know your body, because you know the difference between tired and not okay. And that line is something that you need to be able to confidently convey to your healthcare provider. That's a difference that we teach our champions how to differentiate. But I want to sort of pull the lens back a little bit, because we don't have good role models for women having heart attacks. We have great role models for men having what I call the Hollywood heart attack in movies. But we have very few women on screen having heart attacks. So when something's happening to a woman, there's no image that pops into her mind that says, oh, it must be that, because it feels like it's an isolated case. And because, as everyone has already said, often the symptoms are sort of vague and nondescript, things that we may have felt before, tinges. It's difficult to say, oh, this is heart disease, or I'm having a heart attack. So knowing your body and understanding what is different, if you used to be able to walk up a flight of stairs with no problem, and then the next day you're huffing and puffing when you get to the top, that's different, right? That's unique. And so we really emphasize looking out for what feels different to you, even if it feels like it's just an extension of fatigue or extension of tiredness.
So in terms of using high profile people to get the message across, I mean, presumably you'd advocate patient organizations having alliances with famous people who maybe can talk about their experiences, because those are the ones that get across in the media and get the headlines. Absolutely.
Yeah, I get a ping every time a famous person has a heart attack and survives, so that they can talk about it. Oftentimes, American Heart Association is fantastic. It's grabbing those people and saying, let's put them out there and make sure we get the message out. They've got such a broad platform. But I'll say that there is also a stigma around women having heart disease. From the stories that I've heard, women are reticent to come forward because there's sort of this blame of, oh, you didn't take care of yourself, that's why you have heart disease. And so we've got to get past that too, that there's a bias, and sometimes it's an internal bias. Say, oh, I've taken too much on, like Carolina said, I've taken too much on, and that's why I've ended up in this state. oftentimes we find that the ones who are most challenged in the healthcare setting are actually the ones that are most informed. It's not the ones that are not, that don't have an awareness. And so it's making sure that you are confident and you're advocating for yourself in the context of the healthcare setting.
Well, let me come to that, to Jackie again then. On how would you advise women to advocate for themselves to doctors who are being dismissive? What's the best way of getting across in the language they understand?
Well, I think, you just mentioned something that's very interesting, is the language. I think that we as women will downplay what is going on with us, and certainly we sometimes get into the "I'm sorry" mode as well, where we're apologizing for taking their time or wasting their time, or I'm sure it's nothing, right? We're very dismissive, and it's very important not to do that. And in terms of language, I think it goes both ways. I think we as women need to understand that we can use different language to explain what's going on. Women have a tendency to say, well, I have pressure. Men have a tendency to say, I have pain. So I think that we need to be more aware of what language we're using and be a little bit more descriptive on what is going on. Also, we need to be, again, going back to that, being aware more of what our symptoms can be. Do you have jaw pain? Do you have lower back pain? Do you have, is there pain radiating in both arms? I mean, these are all things that can be very symptomatic of having a heart attack. I'm so sorry, my light keeps falling. And then one of the other things is, please be prepared when you're going into the hospital. If you can, bring a notebook so you can make sure you can write down things that the doctors say. And then also have a journal that you can write down your questions and symptoms. That is so important, because we get so caught up with what the doctors say, and we don't want to be inefficient. And that's one way we can assure to do that. And make sure that they understand that you're clear, make sure that you're clear about the fact that you're a partner in your own care. Doctors often feel that they need to give us the information and then that's it, you'll follow the orders. Well, no, we need to be, we're working on this together as partners, right? And then also when you're going through your appointments, make sure that you ask about supports and services that can help you. Every country, every city, every province for us here in Canada is different in terms of what resources might be available to you as someone who is living with or just being diagnosed with heart disease or a heart attack or with heart failure. So, I mean, those are some key things. And the last one I would say is, if you can, bring a friend, bring a family member with you to your appointments, because a second set of ears is very valuable. And if you can't do that, then ask for permission and record your appointment so that you can go back and actually listen to it again. I found that was incredibly helpful to myself as well as to other women in the group, especially for women who are getting that diagnosis for the first time. You blank out. I mean, I remember when I was told I was in heart failure, I don't remember 15 minutes of my appointment. I just zoned out. It was such a shock to me. So I think it's really important that we make sure that we have those tools available with us when we go. And that's even for the hospital. Make sure that you're very, prepared when you go in. It's like, no, I know something's wrong. I'm not going to apologize for taking the resources that are coming to me.
Yeah, thanks, Jackie. That's really helpful. And that's partly answered a question from Helen Robert, who said, have any of you had any successful strategies for getting physicians to pay attention to these messages when they are so overburdened with urgent patient priorities? Well, that, recording it, well, that's a good strategy. Well, that's separate from getting them to pay attention. Pay attention, yeah. What about you, Carolina? How do you think the physicians will pay attention to you? What do you need to say to them? We've talked about use of words, words like pain rather than pressure, spelling it out clearly. Are there any other strategies that you can think of that have worked for you?
Yeah, I think that often women downplay or dismiss even their symptoms. They go on with life. They have to take care of children. They have to take care of family. They have to go to work, to school, do everything. So I think they know something is wrong with them, and they should be more stick to facts and be well prepared when they go to the physician, and don't let them send you away. Think about yourself, because you're feeling something that is not right, and there's something wrong with you. So don't let the doctor send you away, as I did. Whilst I had a very good job getting everything done So it was a different Caroline at the doctor's office.
That's an interesting point. Yeah.
Yeah.
So I want to come on to a slightly different subject now. Vilma was talking about how there was a real psychological and mental health response to obviously what she found when she was diagnosed. She had a lack of sympathy, fear, anxiety, and stigma. Vilma, in terms of the consequences that you can expect as a woman for your mental health as well as your physical health, what would you expand a little bit more about that, and how can women deal with them?
Well, I experiment after the open heart surgery, the depression and anxiety with suicide ID. And what saved me, I will say, because I talk with other patients, because when I went to the doctor and said, look, I think there is something wrong after the surgery. I don't know, I cannot talk about this with my family because they are so happy that I'm still alive, but something goes wrong. And surprise, doctor told me, that's part of the process, but no one informed you. No one tell you that after this kind of surgery, you may have an experiment, a depression, severe depression. You may think of suicide, okay? So that's also a mistake, that we do not provide all information. And they did not provide information to the women because we are emotive, apparently. We cannot share all these things, but it's wrong. I mean, if you know what's coming, then you can prepare, at least you can talk about this, you can put in place some action. So that's why for me, the mental health program is really important, not only for the patient, but also for their family to be aware about that it can happen. Please look to your, the person who have went to this kind of surgery, because when you are in depression, especially after open heart surgery, how can you tell to your family that you only want to die, that there is something wrong? So either the patient, but the family have to be informed, have to be trained about how can I support this person during. So the mental health for me, it's key, not only for the patient, but for everybody, and for the doctor to respect the patient by telling everything that he has to know. And it's our responsibility to say, I take it or not, and to be able to respond to this. So yes, and just one thing that I want to mention, it's not so easy to go to the medical team and to speak up, because we are not trained. We don't know. We don't know our symptoms. Even you listen to your body doesn't mean that you will know what is the difference, because you know nothing about heart disease. Okay, so how can you, even if you see, because when I arrived, everything was blue on the left side. I was tired, but I did not suspect any heart defect. I didn't know about this. So first of all, it's to be aware and to make public information, to train people about what we are talking when we are talking about cardiovascular disease. And then how can you now go to visit your doctor and to be able to speak up, to ask the right question? How can we do that? How can we have the strength to do that? That was something that we need to change.
So maybe some primers, some educational type primers for women to be able to ask the right questions, to say, when they go to their doctors, so the doctor can't just dismiss it as tiredness. I saw Celine nodding when you were talking about depression, and I suspect that many other women have come, as part of your organization, you've heard similar stories. Do you want to expand on the emotional and mental challenges of heart disease?
Yeah, I have been privileged to be in the room when the light bulb goes off for a patient. I did some rounds in a hospital with one of our Women Heart Champions, and we went into a hospital room of a patient who was sitting with her husband in tears. She was waiting to have a procedure, and she thought her life is over, basically. She was afraid. She didn't know what was going to come next to the point that was just made. And the champion, whose name is Kathy, she was able to sit by her side and say to her, I was in the exact same position as you 10 years ago. And here I am helping other women. And I could not believe the transformation in that woman in that moment, because she was able to see 10 years down the line from this surgery. And that is the power of peer support. That right there, to be able to look at somebody and say, oh, there is life after this. I can do this. And even better, I can help other women when I get better. So that was just a real transformation that I think is so incredibly valuable. And it's hard to articulate that when you don't witness it firsthand. But Jackie, I want to go back quickly to, you asked about tips in the context of the hospital. And one tip that I thought was really powerful is when you present and you say, you would like to be worked up for a heart attack, and you are denied or you're told to go home because it's just stress and anxiety. I've heard women say, can you please note in my records that I requested the testing and I was refused? And that alone gets the attention of that doctor. And that alone meant that they got the tests. So accountability is part of what we're talking about here. And knowing the patient has to know that they have some power, that it's not all in the hand. Jackie mentioned the word partner. You are the owner of your health. The doctor is not the owner of your health. You are. And if you walk away, right, without the test that you think you need, then that's kind of on you in the sense that, you need to speak up. No one else is going to do it for you. And I love the analogy of, you got to put your seatbelt on first in the airplane, or you got to put that oxygen mask on first, because you can't be there for others if you don't.
I think one of the fascinating things that I think it was useful, but forgive me if it was another speaker, may have been Jackie, talked about about how there's a better outcome for people with cardiovascular disease of both genders if they have a female cardiologist. Now that's absolutely fascinating. And of course, I think you said 40% of cardiologists are women. Well, I think
Jackie, 14.
14, okay. So it's terrible. And that's in the US. So it must be, I guess it's probably lower in other countries. It seems to me that male doctors, male cardiologists can learn something from their female counterparts, and we need to train more and support more women doctors to become cardiologists to reverse this. But that's more a question for government. We'll come on to that in a minute. Yes, asking for a female doctor, is that possible? Can you say I want to see a female cardiologist?
Well, it depends on where you are, right? If you live in the rural areas of America where there's one cardiologist for, within a 2-hour radius around you, then that's probably not likely. Which is why, there's a lot of efforts to increase the number of women, not just cardiologists, but doctors in general. We have heard many stories of women who simply say, I want to be seen by somebody who looks like me, so that they understand the experience that I'm going through, whether it is from an ethnic perspective, a cultural perspective, a gender perspective. And the outcomes just really make a huge difference when you can talk to somebody and say, you've been there before, you know what it's like. And so that representation is key. Unfortunately, we know that the more diverse groups of physicians and cardiologists are in the bigger cities. And so telemedicine has actually really helped to expand and extend the reach of these physicians to areas that might be hard to reach and travel from.
Okay. Vilma, did you want to add anything to that on the point about diversity? You mentioned that in your talk a little bit.
I'm sorry, can you repeat?
Sure. I wondered if you wanted to touch on Selena's points about diversity and lack of diversity amongst cardiologists in certain areas, and if you're not in a city, is that an issue?
That's the same in Switzerland and also in Caribbean islands, especially in Caribbean island. We do not have a lot of specialists, and I think few women are here. So yes, and I also agree with you that sometimes the fact that we have women as a doctor make the conversation more easy. Because something that we don't want to share with the doctor, or because it's a man, because we believe, because of some value or some clients of religion also. So yes, however, I think that again, how to empower people, a patient, really to be able to stand up and to ask the right question and ask for answer. Not just something like that. So.
Absolutely. I've got a question here, moving on from what we talked about regarding how you speak to doctors, but we've talked about lobbying. Selena spoke a little bit about lobbying. Reza Mallory has said, can you expand a little bit about that? And I want to extend it a bit. So what government resources and action is needed to change and to improve the system of diagnosis and treatment and care of women with heart disease? So I'll come back to Selena in a minute. We just heard from you, but Jackie and Carolina, in terms of lobbying, how can the government be influenced on this subject to make sure that women are getting the best possible diagnosis and care? Come to Jackie first of all, then Carolina.
That's a big question. It certainly requires a certain, I almost need a moment to think about it, because it's here in Canada, it's very difficult to try to create lobbying opportunities as an individual. It definitely is much easier when you're associated with a organization. And so there is Heart and Stroke does a great job of being able to lobby the government, and they have events that happen on Parliament Hill in order to be able to try to move the needle. Recently, just before the pandemic, we had an effort on Parliament Hill to raise awareness and to raise the awareness of the fact that more research dollars needs to be put into women. And it was quite successful. And there is now a number of research grants that were given, government grants that were given out to various hospitals across the country. Ottawa Heart has definitely been a recipient of that, and even with some funding being put into the Women at Heart program that they run. So it can be a very challenging thing to try to reach through to the governments. I know that in other countries, lobbying is a big part of their system. It is less so here in Canada. There is more systems of provincial lobbying that happens down into our cities even. And then you require a certain group of people to come together to do it. It's very difficult to get in to see as an individual. It's a part of the system that actually is frustrating for patient advocates like myself to be able to step into. And we're working with Heartland. HeartLife is working very hard and diligently to try to help guide that a little bit more, and so that we do get a little bit more access to our MPs as well as to our other parliamentarians to be able to get more exposure. There's also a lack of recognition that women are different. I recall being at an event just a little while ago, a couple of years ago, just before the pandemic again, and the event was labeled Women and Heart Disease. And our health minister at the time stood up there and said, and this event for heart disease for men and women. And I just shook my head. I'm going, are you serious? So there's still a lack of acknowledgement and recognition, and certainly just knowledge about the fact that there is a separate course that needs to happen for women in order for us to be able to get the proper care and the treatment that we deserve. And then from there, it also goes into the education bodies as well, of course, right? And that's where the Canadian Women Alliance is doing such a great job, because they are changing how doctors are being trained, how researchers are looking at their own results. And that in of itself is putting pressure on the governments too. So I've taken a lot of time, so I'll let Carolina answer now.
Carolina, yeah, we've just got a couple of minutes left, but Carolina, yes, what do you think about lobbying? And I want to come to Selena as well, because it was Selena who made the original point. Carolina.
Yeah, well, I think this doesn't only apply for women in heart disease. I think there's overall not enough attention for the differences between men and women. If you look at the COVID period, that was a great period for the differences in men and women. So I think we should start there. If you see that here the education for doctors is not a specialized, there's not a special part for what can happen to women. It's all one education, so nothing particular. So I would start there. That would be great. And we're doing that here in the Netherlands. There were a lot of women that gave a signature and brought that to the parliament. So we hope to get some more attention. But if you look at the budget, that's only a very, very, very small portion of what goes to health. Almost nothing to the difference between men and women in general. So not only for heart disease, that's an even smaller portion.
Yeah. Okay. Thank you, Carolina. Let me come to Selena. Just a quick response on the lobbying issue. How can people effectively lobby on this issue?
A couple of things I would say. One is patients need to be trained on how to speak to lawmakers. It's not enough to get them in front of lawmakers to share their stories. They've got to be succinct, and they've got to connect their story to whatever the policy is that they are lobbying for. The second thing is research funding for women with heart disease is a universal need. No matter where you are in the world, we need more of that. And so I would just tack that on to whatever other lobbying efforts you might have going. And the last thing I would say is that there is heart disease in women embedded in lots of policies that don't say heart disease. You've got policies around maternal health. Maternal mortality is about heart disease, but nobody talks about the heart disease. That is just the next line down, right? We're trying to improve outcomes for mothers. Well, we need to improve heart care for mothers is what we really need to be doing. So, just because it doesn't say heart disease in the title, it doesn't mean there are no implications for heart disease. So I would encourage patient advocacy groups to read a little bit further down in the paper, because there's probably a real need to hear from women and their stories and real life examples of how their lives could be improved with better policy.
Okay, thank you for that, Selena. Now we just got a couple of minutes left. I just want to ask, in the last stages of our panel, just a quick kind of wrap up and takeaway from each of you, just 30 seconds. What's your key takeaway that you would want patient groups around the world hearing about all these issues that we've been discussing? What's your one takeaway for them, the most important message? Vilma, I'll start with you, and then I'll go to Carolina and to Jackie, and then to Selena. So Vilma, what's your most important point you want the audience to know about?
So first of all, we are responsible, and we can stand up. We can make our voice heard. We can look and create a community, strong community that support each other in whatever we need to know, and how to prepare ourselves to live the lives that we want to live. Thank you.
Thanks, Vilma. That's great. Okay, I'll come to Jackie now. Jackie's having a problem with her mute. That's it.
I was struggling with it. In terms of what organizations and can do and such, I mean, one of the things I'd like to really see is to have a lot more awareness out there. So campaigns that will actually help to drive the fact that women get to know that heart disease is a #1 killer. We need to change that tide of the fact that women are not aware of this situation, that heart disease comes in many forms. And as Selena mentioned, certainly if you've had a complicated pregnancy, or if you've gone through menopause, if you've had cancer treatments, I mean, all these different things, or if you've been under an incredible amount of stress, I mean, all these things, if you smoke, I mean, there's ways that you can open up the dialogue. And so I would love to see more efforts by organizations to be able to get that awareness out there. Selena mentioned that it was less than 50% down in the States. It's less in Canada. There was a recent study done here, and we've dropped by 14% here in terms of awareness that heart disease is the #1 killer of Canadian women. So that is my big takeaway, is let's try to be proactive and get the information out to the women that need to hear it.
Thanks,
Thank you.
Jackie. That's great. Right, I need 20 seconds from each of you, and then because we've got to get back to the next session. But Carolina, what's your takeaway?
Yeah, I think that it's very important that the knowledge is spread bottom up. So as a patient, you have the responsibility. If you find out stuff, you can share it with other people and make sure that it goes to the cardiologist and to the doctors and to your friends, so that everybody, I think that if I had the tiredness, somebody would have said, maybe it's your heart, that it would have helped a lot. So I'm asking everybody from knowledge, bottom up, share your information.
Thanks, Carolina. Pass it on, absolutely. Celine, the last word from you. You're on mute.
My last word is, let's stop apologizing and let's start getting angry. This is a matter of justice, and there is urgency in the matter. We are losing lives unnecessarily.
Well, very well said, Selena. Thank you so much for those closing words. I mean, what I've taken is some really excellent tips for you to tell women, you know, record your conversation in agreement with the cardiologist, so you know and you can remember it, and ask for those tests and then get it recorded on your notes if they say no. Two very practical things, and just awareness, absolutely. It's been the most fabulous session. Thank you so much for all of your remarks and your advice. We are over time now, so we need to go back to the main session for the Unite Summit. I'm sure there's lots more to be said, but please carry on the conversation, and thank you very much indeed to our excellent panelists.
Thank you.
Thank you.